Good afternoon, everyone. We'll just give it one more minute for everyone to join us. All right, so we'll get started here. Good afternoon. Hello, everyone. Welcome to our industry showcase on October 28th. My name is Ashley Caesar. I am the Programs and Events Specialist here at Digital Health Canada. And today's industry showcase, so it's AWS presents Cybersecurity Awareness Month, leveraging Amazon Web Services and identity security as the foundation for zero trust in healthcare. And joining me today is Erin O'Halloran. She leads the team supporting intuitions and organization in Western Canada. And we also have Frank Brigulio. He is our global public sector strategist for SailPoint. So we will have time for Q&A at the end of today's presentation. So please type your question in the chat box at any point. And thank you all for being here today. And I'll pass the screen on to you, Erin.
Thanks, Ashley. Morning, Frank.
Good morning. Thank you for having me.
Of course. Looking forward to seeing the presentation. Happy almost end of Cybersecurity Month, Frank, and to everyone that's listening. We've had a good month of education and learnings with my healthcare customers in Western Canada, and at AWS, it's our top priority and our #1 priority. So looking forward to the discussion and presentation today. For those of you joining us, let's make sure everybody's awake, depending on whether it's morning or afternoon or evening. We're all tired at different times during the day. So if everyone wants to drop into the chat, maybe what beverage they are enjoying right now. No judgment, but could be coffee, could be something later on. I know Frank's a proud Sicilian. We talked about that before we got started. So maybe it's a red wine if you're later in the day. All right, we got an iced coffee. I just finished my flat white. Timmy's steep tea, that's a good one. That's a Canadian for sure. Lemon water, awesome. All right, Frank, everybody's hydrated and ready to go. So I'm really excited to hear about what you're going to share with us from SailPoint. And for those of you who know SailPoint, welcome to some more learning. For those of you new to SailPoint, they're the leader in identity security for the modern enterprise, and they harness the power of AI and machine learning and automate the management and control of access by delivering only required access to the right identities and technology resources at the right time. Their sophisticated identity platform integrates with existing systems and workflows seamlessly and provides the singular view into all identities and their access. SailPoint meets customers where they are with an intelligent identity solution that matches the scale, velocity, and environmental needs of the modern enterprise, and empowers the most complex enterprises worldwide to build their security foundation grounded in identity security. So I know this is a really salient and relevant topic for many of our participants today working in enterprise. And I'm pleased to turn it over to Frank, who's the SailPoint Global Public Sector Strategist. Mr. Brigulio is a recognized thought leader and seasoned cybersecurity professional with more than 24 years of experience in identity, credentialing, and access management, and has extensive knowledge of government security and compliance standards and hands-on experience in designing, implementing, and managing identity-centric security solutions. So thanks so much for being here, Frank, and bringing us your expertise. I will turn the floor over to you and look forward to learning.
Thanks, Erin, and thank you, Ashley. It's my pleasure to be here today. I'm going to go ahead and get sharing, so give me 1 second. That should have taken care of that. And welcome, everyone, and thank you for joining today's session. As Aaron stated, and Ashley, the topic today is leveraging Amazon Web Services and SailPoint Identity Security as the foundation for zero trust in healthcare. During the session, we're going to discuss some observations in the healthcare industry that are driving digital transformation and cloud adoption. Then we're going to look at the impact to securing protective health information. And then we'll discuss the need to rethink how we approach Cybersecurity Day. And then to wrap it up, how SailPoint and AWS provide the path forward to protect sensitive applications and data. So with that, let's go ahead and get started. With digital transformation and IT modernization underway, coupled with the onset of the global pandemic, healthcare organizations are adopting new ways to do business and new ways to enable providers to make better care decisions. But with these changes, organizations have quickly realized the complexities that more data, more applications, and more infrastructure meant more individuals required access, and that access needs to be safeguarded. And with so many healthcare employees having various roles and privileges within a healthcare organization on the network, there must be a balance between keeping access available while always protecting that data. And in this setting specifically, losing access to a patient's health record or health data or privacy data could be very well dangerous situation. The impacts of cyber attack are much greater in this sector because of what's at risk, the patient's health, and in some cases their lives. So ultimately what we're talking about here is keeping the patient safe while at the same time keeping the critical data safe and protecting our most valuable assets. So as I stated, cybersecurity in healthcare, it's a little different. I'm used to talking about the federal government, whether it's a global government in Canada, the United States, Australia, New Zealand. I speak to them all. One of the unique things I get to do is talk about healthcare sometimes. And like I said, it's a little different. And healthcare strategies require a little bit different approach. The defensive strategy to protect the organization's resources. And with that, we need a couple different approaches, technology and organizational strategies to resolve the challenges between security and, most importantly, productivity within the healthcare organization. And as I mentioned before, this is a utmost importance in the industry because hospitals need to strike that delicate balance between strong security and usable systems that enhance patient care without barricading that information, in inaccessible vaults. We need to access patient records and clinic results and things like that more frequently. But this also often breeds frustration within the organization that can be time wasting. It can breed inefficiency for clinical staff, particularly considering the restrictive privacy controls that, an organization is constantly being measured against. And the new landscape that we're now facing must also consider that workers are now accessing the networks and sensitive information from their own devices or their home computers like we're doing today, and making it even more challenging for IT and security teams to manage and control access. And with that, we need to think every point of access is a potential point of exposure for the adversary to exploit. Ultimately, the heart of many issues between security and efficiency is how access is being controlled, how it's granted. But entitlements and permissions to data cannot be a free-for-all. So how do we determine who should have access, who does have access, how they got that access? And most importantly, is that access still suitable and important to the role? And those are the kinds of things we're going to step into and discuss. But before we do that, I think it's absolutely critical that we take a moment and look at the state of the industry. As I mentioned, with modernization of healthcare systems, And the explosive growth of electronic protected health information, coupled with the advances in technologies, means that healthcare data is growing exponentially. And there's no signs that that growth of this data is going to decrease. So we need to take it seriously, and we need to protect it appropriately. One of the interesting things I found is that 20% of protected health information sits in neatly structured data repositories. Those might be your databases. They might be, a directory server, or within an application itself. And that's really where hospitals and healthcare organizations tend to direct most of their data access and monitoring efforts. But the real concern is that data that lies outside of that structured system. Those data such as faxes, clinician notes, radiological images that aren't being monitored. That data is being stored, for example, on the enterprise file system or in an AWS 3 cloud bucket, and those require the same vigilance, governance, and control. And, with that, let's think, and we're probably going to mention this a lot, but, in other industries, organizations can lighten their data load by simply disposing of records when they're no longer needed. That's not the case for hospital and healthcare providers. Healthcare organizations are subject to data retention rules that limit the ability to reduce, this petabytes of data that's being created. And if that's not complicated enough, there's no single standardized record retention schedule for providers to follow. So as I mentioned, the question really becomes one of vigilance and how we're going to take care of this data. The next two things we're going to look at are kind of quite staggering, and it's no surprise that hospitals are a lucrative target for cyber criminals. With medical records fetching a good deal of money on the dark web, it's critical that we protect this. It's a lucrative target. They give malicious actors leverage in fraud and taking over identities, and this is pretty critical. So we have to focus on this critical thing. The other thing is that the typical healthcare delivery system is home to hundreds of data processing systems, and as we saw, petabytes of data. So it wasn't surprising that there's this growing list of institutions, especially when it's lucrative in that they can get paid for it, that institutions have been fallen victim to breaches over the last year. A couple examples of that: Life Labs, which is a Canadian diagnostic and specialty testing company, had a cyber breach, potentially exposing the sensitive information of millions of patients. 3 different Ontario hospitals have been struck by ransomware. And then eHealth Saskatchewan, another example that manages the province's personal medical health records, was compromised. And again, in Nova Scotia, patients had information about their surgeries exposed during recent attacks. That's pretty significant when we think about it. And within Canada itself, healthcare security breaches accounts for nearly half of all the security breaches. So again, just identifying that it's essential that organizations understand how to protect their data. And there's many different ways to do that. And I just want to clarify here, we're talking about one approach, and there's many, and they all need to work together. You'll probably hear me say cybersecurity is a team sport many times during this presentation. So to summarize why identity security matters and why this transformation is critical, let's just review a little bit. As we stated, hospital and clinics in Canada, as well as across the globe, I do not want to pick on one specific region, struggle with growing cyber threats amid this COVID-19 pandemic that we're still dealing with to some respect. The reason it's not uncommon for healthcare institutions to spend a bare minimum on IT. They're putting their dollars towards frontline care services, and that's where they should be. But unfortunately, as we saw in that last slide, criminals know this, and they're increasingly exploiting this fact. So it's time that we rethink security. It's time that we shift away from a technology approach to one that's more people-centric. We've identified that the workers are the new target, but they are the new perimeter as well. And we've been saying this in the identity field for quite some time. The identity is the new center of cybersecurity. It's the new firewall. And it needs to be the foundation of a modern security approach. And that's what we're going to talk about today in context of the enterprise applications and cloud infrastructure and cloud services. So let's go ahead and get started. But first, we have to be able to answer some basic questions about access in this sophisticated and complex environment. These sometimes can be hard questions to provide answers to. How do we provide accurate, secure, and timely access to data, applications, and resources? How do we determine who has access to a cloud environment or those S3 buckets or a SaaS application? We have to be able to figure out, how are they getting that access? Are they using that access? So to start this all off, at SailPoint, we believe our platform and our alliance partners today, like AWS, enable identity and security for the cloud enterprise. So before we go into the principles of identity in a zero trust architecture, I'd like to take us a short minute and just talk about our product vision, some of the capabilities, where we're headed with this. Just to give you an idea, we're going to go through some high level pieces of the platform and zero trust in a second. But our vision in where we're moving is from a static provisioning state for identity governance to one that matches the dynamic security nature by providing a platform that provides intelligence, automation, and extensibility. Our platform goes deep and it integrates with applications and tools that you already own, but it provides visibility, context, and control for all those entitlements and data through a single pane of glass. The platform goes across all types of identities. We're not just talking about the human carbon life form accessing systems any longer. We're talking about robotics. We're talking about devices. We're talking about APIs. It has to go across the infrastructure, and that infrastructure might be in the data center or it might be in the cloud. All types of applications need to be considered, whether they're a SaaS application, a clinical application, anything. All of these must be included in this context, and we need to associate all the different types of risk. Is it a vendor that comes in just for one day to do maintenance on a system? Or is it someone that is always within the organization? Or have we opened up to different research partners and mission partners? So we need to have that third party risk also into this. And this is where the contextual nature that identity provides allows us to build an automated decision-making platform with triggers, alerts, and response. So let's go ahead and take a deeper look. Excuse me. At SailPoint, we deliver our solution in AWS global regions as a software as a service, as well as a software stack that can be deployed in the data center, or as many of our customers do, in their own private cloud. The platform itself delivers capabilities through microservices. The platform connects to everything, everywhere, through connectors and integration modules. As a matter of fact, we have over 100 connectors and integration modules that go broad across an array of applications and technology, and go deep, as I mentioned, into applications providing access to things like schema elements, roles, access policies. And then we couple this with our microservices that are tightly integrated and part of our core platform. They provide that single pane of glass I mentioned for ultimate visibility, control, and compliance. And as you heard in the introduction that Aaron made, the platform seamlessly integrates with existing systems, workflows. And this is critical that we have easy connectivity. We've taken the complexity out of connecting these systems and bringing all of this data together. And we harness that power of AI and machine learning, to automate the management and control of access. And this is critical in that we can, take the human element out. And you'll see where we're using AI in a few seconds for, our recommendation engine for access certifications and approvals, for doing peer group analysis and things like that. We don't have the time today to go into each of these things in detail. So I'm going to give you a brief, skim across the top of the capabilities. But as you can see, the key features in service of identity governance and administration are provided in this core. Those are the things that we do on a daily basis. We make access requests, we provision, we deprovision, all according to, those triggers or that metadata that we know about a user. So we can change passwords and enforce policies. But the idea is providing this foundation, that is built on these connectors and integration modules that I previously mentioned, that allows us to provide the automation and share attributes and identity metadata with the applications that you're using today across the enterprise, and then also your security ecosystem. So this first, just view into the platform, and I have a few here to really address some of the extensions to the platform above the core. The first we're going to discuss is access requests. We do these every day, so it should be easy. It should be frictionless. The access request catalog that we provide allows users to request and fulfill an application request through a single interface. But this increases security and compliance, because you'll see that we'll talk about policy enforcement in a second, but this allows us to, upon request, enforce policies for suitability or least privilege or toxic combinations of access. And then when it's time to review that access, as I mentioned, we use AI and we deliver recommendations to the approver. So we streamline the process of recertifying access to meet our compliance objectives, but we empower the user with better yes, no responses when they're making these approvals. And as I mentioned, one of the most important things, and I think this is critical in any area, is that we provide this automated policy enforcement. The platform delivers these policies by identifying and evaluating the entitlements that a user may have, the metadata that we know about them, to prevent overexposure or excessive access. And we provide the alerts and the remediation recommendations. And with our AI, we're going to get to where these are autonomous. These can just happen. So this is pretty critical, especially when we're talking about data. And our data access governance, it extends what we're doing with the identity to sensitive data, such as that protected health information that we talked about. No matter if it's in the cloud or on your data center file system, we're going to look at visibility. We're going to look at permission analysis. We're going to look at data ownership. And with the metadata, we can bring all that back into a single pane of glass. The next area that I'd like to bring up is what we're doing in SaaS management, where we shine a light on the access risk that SaaS applications can bring to the organization, especially those that might be deployed by shadow IT. So we're providing, again, this complete view of enterprise, the SaaS footprint, ensuring that every application has the right visibility, compliance, and control. This is critical. We have many departments that will launch a SaaS, application campaign without the full support, and they adopt these tools, and that shadow IT can get us into trouble. Our access risk management module extends access controls deep into ERP systems and other applications for that continuously real-time, evaluation of access risk. And most important, with our partner here today, AWS, our cloud governance platform, where it provides clear visibility into your AWS infrastructure. Also, if you're a multi-cloud enterprise where you're using Azure and GCP, all of this comes into a single pane of glass within this platform. So we're looking at all the different complex logic paths that each of the IaaS vendors provide, and we're making them human readable. These can easily, lead to misconfiguration and data leakage. If you look at some of the cloud data leakage that's happened over the past couple of years, it in many cases points back to, misconfigured access policies. They're not human readable, they're difficult. So what we've done is we've provided a platform that takes those complex access control policies and brings them back. And we can provide this continuous monitoring, alerting of inappropriate or unused access. We can see what people are doing, what they're deploying, and apply consistent controls when we bring it back to that area where we're doing policy enforcement and continuous evaluation. So we're going to start shifting gears a little bit, and we're going to talk about zero trust principles, but through the lens of identity security. There's many different lenses in zero trust that we can look at, from the data perspective, from the device perspective. It's a three-legged stool, really, when we look at data, device, and identity. So we tie the identity to the data, as we mentioned. We tie the identity to the device, but we're specifically going to talk about zero trust principles through this different lens of security, where security is the foundation. Excuse me. But why is digital transformation accounting for so much of our investment in IT? It really is to drive those operational and clinical efficiencies that we talked about. And as we said, organizations have realized this means more data, more applications, more users. But what they've really realized is patient first means secure, transparent data sharing and collaboration. However, given the nature, the interconnected nature, really, of the future with medical devices, the influx of other technologies, I mentioned there's robotic process automation, there's bots, there's all these different things that are being introduced, APIs. It's clear that our single current perimeter-based security model that most organizations use will no longer be an effective way to safeguard our information. So to stay ahead of these trends in this digital transformation and cloud investments, organizations, have to continue to invest in the basics, but make this fundamental shift from the castle and moat approach to a more zero trust model. I think it's interesting when we look at this word cloud. We've captured a few, not all the reasons that our existing healthcare customers are using zero trust and identity management for reducing these security, breaches or cyber attacks. But maybe a few of these resonate with you, maybe all of them. In the next slides, we're going to talk about, what zero trust means to healthcare. We're going to look at some of the characteristics of zero trust and the principles, and then we'll circle back and tie all of this together at the end. So let's start with the first principle here. Never trust, always verify. With zero trust, or and let's call it modern security architecture, because let's be realistic, zero trust is an overused buzzword. But with that, We need to keep asking ourselves questions. We need to ask questions about behavior patterns, as well as taking a more in-depth look at users' attributes and context. It's essential when we're making access decisions in the enterprise and within the cloud environments that are based on this context. This up-to-date identity data allows us to make these decisions with confidence. So having this, reliable data source or single source of truth with this complete 360-degree view of all enterprise access and relationships, it's absolutely critical to establish our risk posture and our mitigation strategy. So we're next going to talk about, delivering just enough timely, least privileged access, and an approach for delivering, this just enough access in a timely manner. It requires us to have a solution that limits access rights, for accounts, processes, like I've said, and to users, where they actually require when performing their typical activities, in the enterprise. And this, like I said, this should take into account all access for all user types. Least privilege helps us reduce the attack surface. It helps us eliminate the unneeded pathways to data, and can provide, the platform, that we select for this, that we deploy, needs to provide governance rules and guardrails that will automatically monitor and alert us. Cloud environments are dynamic, changing daily. So we can't have this static approach. So as we move forward, we need to be able to automatically grant and update and revoke access as new users or new systems, come into the environment. We need to reduce the risk exposure by removing access when it's no longer necessary. But we need to detect and really prevent those toxic combinations of access through the policies that I was talking about, to prevent our fraud or future data leakage. But ultimately, we're talking about granting just enough least privilege access, using fine-grained entitlements, permissions, and rules. So the next part of this is, continuously monitoring, analyzing, and adapting within the environment, whether it's the cloud or the data center. And in order to keep security up to date and dynamically respond as things change, we need a solution that's going to monitor and drive that deep visibility and understanding in trends, outliers, relationships. That's critical. We need to measure the efficacy of access controls for all things in the environment, and make sure the permissions that have been granted comply with our strict regulated policies for privacy and data protection. And we need to automatically adjust those controls, like I said, as things change, as that threat surface changes, or we increase the amount of things that we're pushing into the cloud. And we need to continuously evaluate the risk signals across the environment. And that is probably the most important thing. Is, like I said, this is not a single activity. We need to take signals through the access management layer, through the insider threat tools. There's many different signals that tie back to the identity. So we're going to now bring all this back together. And, I think it's important. SailPoint and AWS are fortunate to be working together with the US NIST Cybersecurity Center of Excellence, with some other selected relevant vendors, to implement and exercise and document zero trust use cases for all market sectors and disciplines to consume. This is a cooperative research agreement that we're working on, and it's going to provide some great value. The program's just started, so give us a few months, and if you're interested, the information is available on the NIST Cybersecurity Center of Excellence website. But there's going to be a lot of great information and a lot of great cookbooks and documentation that come out of that. But I think, the most important thing out of that, it just further solidifies that modern security is a team sport, not only across the enterprise, but within the vendor community itself. We all have to work together. Again, I say this a lot. But now that you know what we do and you have a better understanding of the principles of zero trust and as they relate to identity, let's review it a little and put it all together. You know, SailPoint Identity Security, we're directly aligning with your digital transformation and modern security strategy. And as you've seen, we've embraced zero trust and are building the innovative solutions that help the modern security architecture. I think it's prudent to mention again and again and again, I'm not saying identity security is a silver bullet. There's no silver bullet in this new world. Identity security is foundational, but we're not alone. There's many things that make up an identity-centric security approach, such as access management technologies, multi-factor authentication. So there's a lot that goes into this. But again, I mentioned it's a team sport, and I'm happy to be part of the team. I've spent most of my career in identity and cybersecurity related to access technologies, and it's a great place to be. And SailPoint is a great place to do it with. So to start and put this all together, we're laying the foundation for that access management that I just mentioned. All authentication decisions, are reliant on an accurate identity record. The platform manages the life cycle of an identity by discovering, creating, provisioning, and continuously updating that record and the related attributes that we're using as metadata in a directory or identity store. And in those dynamic access control decisions, we're basing them on this identity context, but also device context, right? And then time of day and all these other pieces need to come together. But as you see, the identity is critical in that always verify. We need to know who's accessing it. Are they suitable? The next area we're going to talk about is just enough, that least privilege approach. And as I've mentioned, our policy management capabilities provide that cornerstone for the least privilege authorization model. It's imperative that users are assigned the right privileges from the very beginning. It's imperative that we know how that stands up against other types of users and access that's in the environment. So we give you that powerful ability to bring all of this attributes, metadata, and entitlement into view and apply that policy logic rules for RBAC or SOD, or those dynamic policies that we're using to grant access in the cloud environments. Remember the ones I said that weren't human readable? We can model those within the platform to make it easier. So as we move around the dial here, enabling timely access is the heart of identity management, and it's the heart of zero trust. Of course, user account provisioning and deprovisioning have always been a core function of SailPoint's identity security platform. However, we've enhanced some of our event trigger capabilities, for example, that allow us to respond to changes, as I said, from those triggers within the environment, maybe from insider threat, the SIM, SOAR environment, access management, these places the authoritative data sources. These ensure timely, access, but also timely removal of that access. And that's where identity governance really adds its value to this dynamic environment. If we rely solely on automated provisioning without governance controls, the view gets a little cloudy. And that's where this last piece comes in, where, continuously monitoring is really the heart of the SailPoint solution. As I mentioned, our robust AI capabilities that drive our adaptive governance and access intelligence capabilities allow us to not only manage, but monitor and govern, the access, especially to that cloud IaaS environment where we're storing those sensitive files and images and things like that. Like I said, we're continuously evaluating the controls to answer those questions. Do users have the right permissions? How are they using those permissions? And most importantly, should the policy be adjusted to ensure the access is appropriate? So all of this comes together to protect your AWS infrastructure and the data and applications that you've deployed there. So how do we head off the next data breach? We need to plan, we need to protect, and ultimately prevent. We do this by having visibility into all these data and access relationships, as I've said. But we need to be able to recognize the patterns that are indicating a security event. It might be something like file extensions or permissions that are changing that are detected by our data access governance. It might be, new users or permissions changing in the cloud IaaS environment or within your SaaS applications. These patterns are indicative. When attributes are changing, access should change too. I don't wear a blue shirt every day, but if we're using a policy that says, let Frank in when he's wearing a blue shirt, how do you really know I'm wearing that blue shirt? We need to continuously evaluate the metadata. But just as important is being able to configure those alerts, triggers, and responses to keep the source of the activity or the potential vulnerability from entering the rest of the organization. And that's by reducing, the individual's exposure by tracking all of this and what access they have. When we bring this all together, it's definitely a better together story. And that's where we're headed next. So how can we get started? We need to start by selecting the right partners that are going to make this digital transformation journey to modern security much smoother. And by bringing together a proven and certified solution that is being used by some of the largest financial, largest government, largest healthcare organizations across the globe that have very complex and challenging identity and security requirements, we have partnered with our AWS partner to help you take this next step in your journey. And with that, I'd like to thank you for attending today's session. And if you have any questions, please drop them in the chat if you haven't done so already. And reach out to the SailPoint team, the AWS team, and we'll be happy to discuss our Better Together solution.
All right. Thank you so much, Frank, for a great session today. To the attendees, please feel free to send in any of your last minute questions. At this point, we have one, the assumption here is it that everyone is an intruder until proven otherwise?
Absolutely. Absolutely. Our perimeters are like, turning an Oreo cookie inside out. When you get an Oreo cookie, it's crunchy on both sides, soft in the center. Due to the recent nature of breaches, we've turned that Oreo cookie inside out, and now it's soft and chewy on the outside, and we need to make it hard in the center around the things that matter to us most.
Sounds great. We have a next question here. If you want to use SailPoint, do we get an option in which AWS region, if we want to host it in? Will it impact if my data is in different AWS region?
Yes, you do get to select which region you get deployed in. That is definitely achievable, and our architects can have that discussion with you on the best approach for doing that.
Perfect, thank you. And there's just one last comment / question. They wanted to know if this was correct. Software as a service?
Yes, Yeah, so we offer the platform as software as a service. But as I mentioned, we also have software that can be deployed in the data center or your own private cloud.
All right, perfect. So that is it with all the questions. Please feel free to post any last minute questions before we go. All right, so any last comments from you, Frank, right now?
No, I just want to say thank you for having me. It's been my pleasure. I saw a question about the slides. Ashley,
Yeah.
you should have the PDF version of the current slides I presented. So happily share them, and my contact information. Absolutely, willing to connect, discuss, and anything to take your journey to that next level.
Sounds perfect. Thank you so much. Dawn also responded. She sent her email address. If you want to reach out to SailPoint directly, feel free. I did have the deck. I just needed confirmation from you, Frank, while you were speaking. So everyone who was interested in the deck, please feel free to reach out to myself or Dawn, who left her email address there, and we'll get you the details. All right, so let me just go ahead and, okay, so this session was leveraging AWS and identity security as a foundation for zero trust in healthcare. Thank you again so much, Frank. And next week is our last AWS session, Improve Your Security Posture by Moving to the Cloud. Please register on our website for next week, Thursday. And following that, next week, Tuesday, we have our Driving the Future of Digital Health conference. And then our next set of webinar Wednesdays, which is complimentary to all members, members only. November 3rd, we have supporting clinicians through COVID-19 and using digital health tools and resources. And then the following week is customization of order alerts through conditional filters. Everything can be found on our website. Please register. That's where you're going to find all your information. All right, we're just getting lots of thank yous. Thank you, Frank. Thank you, SailPoint. Thank you, AWS. If we have no more questions, we will end it here early. We'll give you back 15 minutes of your time, which is, I'm sure you would appreciate it at this point. All right, everyone. Happy Thursday. We will see you next week. Thank you again to SailPoint and AWS, and have a great afternoon, everybody. Thank you.